Forever Media, Conemaugh Health System, Somerset Hospital, and the Cambria County Drug Coalition have teamed up to fight drug addiction with our Hearts Against Heroin campaign. And today we welcome Pennsylvania Attorney General Josh Shapiro. Can you update us on what you and the office are doing about the opioid epidemic in Pennsylvania?
Battling the heroin and opioid crisis is my top priority as your Attorney General. Listen, we're losing 13 Pennsylvanians a day, every single day, to this crisis. And, Cambria County has been particularly hard hit. They've got the second worst rate of drug overdose deaths in Pennsylvania. And I've been to Johnstown, I've been throughout Cambria County many, many times. And I have to tell you that while there is a lot of struggling there are also a lot of people working hard together with us to combat this epidemic. And, we believe we've got to deal with this in a multidisciplinary way. That's why we're out in the communities arresting the dealers. We shut down 2 massive heroin pipelines that dumped about 1.5 million bags of heroin into the Johnstown, Altoona community and actually started in New York City, made its way across the state. We've arrested dozens of drug dealers in the community there. But we also recognize that you can't win this battle just with dealers alone. We've stepped up our efforts around diversion. Diversion is when, like, a doctor or someone else takes a legal prescription drug and diverts it for illegal use. We've had a 50% increase in our diversion arrests since I took office in January. And we recognize if you're going to be successful, you've got to look at the supply chain. And for so many people, the supply chain really are the pharmaceutical drugs. 80% of heroin users start with a legal prescription drug. 80%. And they get it from a friend, a relative, who was playing around in the medicine cabinet. And so that's why I've launched an investigation joined by 41 other state attorneys general into the opioid manufacturers, into these big, powerful pharmaceutical companies. And we're going to hold them accountable for their role in this crisis. And then I guess the last thing I would just say on this is the public can really help us in this effort. I said just a moment ago how the pharmaceutical drugs are really the thing that starts off people's path to addiction, and that 70% of them get it from a friend or relative who was playing around the medicine cabinet. That's why we've placed such an emphasis on getting these unused medications out of people's homes, out of their medicine cabinets, and have them destroyed. Around the state, we've got these drug drop boxes, and we've destroyed over 30 tons of these pills so far. And not to state the obvious, but a pill doesn't weigh a whole lot. So 30 tons is a lot of pills. But we know that in some rural parts of Pennsylvania, and particularly in Cambria County, it's hard to find one of these drug drop boxes. So we've taken this fight directly to the people and distributed 300,000 of these bags that people can get at a local pharmacy, take home, and throw their pills away safely in there. And because the chemical that's in the bag, it deactivates the pills. So we're calling on the public to help us deal with this crisis. And so far, the response rate has been terrific, especially in the Johnstown area where people have really stepped up and are willing to help destroy these medicines. So it's particularly pronounced in this region. It's particularly pronounced in certain communities like our veterans communities where we're focused a lot of effort on that. I know we're going to talk about that, and it's something that I work on day in and day out across Pennsylvania.
With veterans, I'm sure it's an issue as well. Many come home with issues, and our veterans are also suffering from the opioid crisis too.
They really are. Look, later today I'm going to be in Cumberland County, which is in the center part of the state, at a treatment center for veterans who are struggling with substance abuse. And I'll be Friday in Susquehanna and Bradford and Sullivan counties listening to veterans and local officials talking about the particular challenges that vets face and talking about some of our ways to deal with it. I think it's important for people to know veterans are twice as likely to die from an accidental opioid overdose as a non-vet. And the number of veterans with opioid use disorders increased, get this, by 55% since 2010. That's just an astronomical figure. Now, the VA is working with us. They've put stricter opioid prescription guidelines in place, and that's a good first step. But we've got to do more to stand up for these veterans. The vets deserve a whole lot better than what they've got, and they deserve us to be focused, as we are in the Office of Attorney General, on addressing the unique needs that veterans have to combat this addiction that's taking hold. Look, a number of veterans are in need of pain management, pain medication. And I want to make sure they get that. They deserve that. And for many of them, that pain occurred as a result of their service to our nation. So we have a responsibility to make sure that they get well and they get the help they need. But loading them up with opioid painkillers in an irresponsible way is not the answer. And we've got to push back on that. And we've got to hold people accountable who aren't treating our vets properly.
We've been speaking with Pennsylvania Attorney General Josh Shapiro. Hearts Against Heroin, presented by Conemaugh Health System and Somerset Hospital, with Spangler Subaru, Martin Baker America, Yeager's Heating Service, First Summit Bank, and Forever Media.